Bismillahir Rahmanir Rahim. Our case today very interesting. 2-month-old boy, known case of congenital hydrocephalus, presented with symptoms and signs suggestive increase intracranial tension. Patient present with abnormal behavior and seizure, persistent vomiting, and poor feeding. Clinical assessment 5S, the skull, full bulge anterofontanel, and increase head size. Regarding to the eye, sunset eyes. Why this patient having sunset eyes? It's due to pressure on mesencephalic tegmentum and paralysis of upward gaze, and also the spine, no meningomyelocele, and the sphincter, there is petulous anus, and seizure, lower limb spasticity, This is the clinical assessment of patient with hydrocephalus. 5S, the skull, the squint or sunken eyes, the spine, the sphincter, and seizure or spasticity of the lower limb. Our assessment, this is rapid onset hydrocephalus. This is one of the medical emergency for which pediatric neurosurgery consulted. For evaluation, assessment, and management. Pediatric surgery came and start to assess the baby clinically, laboratory, and imaging. Clinically, same finding, 5S, this patient having a skull, full bulge anterofontanel, increased head size, and eye sunken, sunset eyes, and the spine, no meningocele, petulous anus, it is the sphincter, the spasticity of the lower limb, and seizure. Laboratory assessment, no specific blood test to diagnose hydrocephalus, and he request for CT brain. Diagnostic for hydrocephalus based on size of post-temporal horns is greater than 2 millimeter. So start medications and start medical and surgical treatment. What is the medical and surgical treatment of the hydrocephalus? Medical treatment, acetazolamide with or without furosemide. It will decrease the secretion and production of the CSF, and you can give anti-epileptic medication to control the seizure. Antibiotic if there is suggestion or evidence of ventriculitis or meningitis. Can do serial lumbar puncture or serial ventricular puncture, and the surgical treatment, it will be VB shunt. What is the prognosis of such cases? Depend on the cause of the hydrocephalus and the associated malformation. So the key point, the message from the case: what is hydrocephalus? Hydro, this is mean water. Cephalus, this is mean brain. This mean water in the brain, or progressive enlargement of the ventricular system. Why? Because imbalance between the production of the CSF and absorption. What is the most common cause of hydrocephalus in utero? Aqueductal stenosis or neural tube defect. There is other causes: brain tumor, Ernest-Chiari malformation, Dandy-Walker malformation. What is the type? 4 types: communicating, non-communicating, normal pressure, and also congenital hydrocephalus ex vacuo. This is the types of the hydrocephalus. How to assess the hydrocephalus? Clinically and laboratory imaging. Clinically, 5S, the skull, spine, in the sunset eyes, and spasticity of the lower limb or seizure, and the sphincter. Laboratory, no specific blood test to diagnose hydrocephalus. Imaging, you can do ultrasound, CT, MRI based on the clinical assessment. What is the treatment? Medical and surgical. Medical treatment, diuretics, acetazolamide to decrease the secretion or production of the CSF. Anti-epileptic medication to control the seizure. Antibiotic if there is ventriculitis or meningitis. Surgical treatment, VB shunt. What is the prognosis? Depend on the cause of the hydrocephalus and associated malformation. ومن أحياها فكأنما أحيا الناس جميعا. شكرا، سلام.